Hello, my name is Natalie Robles, and this is my case study presentation. My client's name is George. He is 6 years old, who received a diagnosis of autism spectrum disorder on February 5th, 2019, at the age of 3. George is nonverbal and is currently communicating through his AAC device. And the behavior of concern is George screaming loudly during therapy sessions. This behavior has been observed to occur, but is not limited to therapy rooms or during any type of work time or transitioning to an unpreferred activity. Operant extinction involves termination of reinforcement for a previously reinforced response. George screams at a high-pitched tone because it was once reinforced to try to make him to stop. That attention, he really liked receiving that attention when he first got it, when as he screamed and immediately what he wanted, which was escape, was given to him. The intervention will involve the use of operant extinction to remove the reinforcement of giving attention to George. When he engages in this loud, high-pitched screaming behavior, George will no longer be given attention of any kind. The therapist will simply just ignore and block any type of escape. As the assessment to ensure that George has normal sensory sensitivity, as well as measuring the different behaviors before and after the intervention is implemented. A replacement behavior would be functional communication to request a break during work. A functional behavioral assessment was completed to help come to this determination. Based on the assessment, the function of the behavior determined was to be socially mediated. The function of the behavior is escape or avoidance. We're noticing the high-pitched screaming only happening during table work, during transitions, or when escaping an unpreferred activity. George does not want to work, and he decides to scream at a high pitch, and it has helped him remove himself from that situation once before, and is continuing to do so because he has been it's worked for him before, and he continues to engage in this type of behavior to avoid anything he does not want to do. Reinforcement was provided as part of a DRA procedure for the alternative behavior of using functional communication to request for a break using his AAC device. The type of reinforcement given is generalized conditioned reinforcement. As this is a stimulus that exerts a reinforcing effect because it has been associated with a reinforcing stimuli, when used functional communication to request for a break, therapists then give George verbal praise and allow for a 2-minute break from any unpreferred activity or table work. Sorry. Stimulus control. Lastly, stimulus control was considered in the development and implementation of the intervention by discussing how to teach independence and how to use prompting strategies prior to the intervention. We want to make sure that functional communication is being generalized and not only used when prompted to do so. Stimulus control is better explained as the rates of responding that happen excessively or at a higher rate in the presence of a stimulus rather than in its absence. Understanding the environmental variables controlling both interfering and adaptive behavior is very important when designing clinical programming for any child. Below are the references, and this concludes my presentation. Thank you. Oops.